And so I'm blessed right now to have a doctor who went through the physician training program with Dr. Horowitz. And he works and practices in Ohio, and he has patients that are autistic, patients who have Lyme disease, and some who have both. So Dr. DeMio, welcome to this 3-hour segment.
It's good to be back in San Diego. It's great to be here.
So prior to joining the physician training program, you came out and did work with Dr. Horowitz. Had you seen much Lyme disease at that point?
Well, over the years, I think we all did, but the way the self-appointed conventional groups are, we're just basically told the testing is perfect, and if serology is negative, there isn't Lyme. And that really rubbed me the wrong way, and so when I found out more about ILADS and what they do in the training program, that was very exciting, because we really needed to come full circle with all these cases that were out there that I thought were there. And so I just really found that to be in the training, and it really worked for us to be able to help more people. It really was very important.
What I find is that there's a certain confidence level that as you get to know Lyme, to pick that week out, do a physician training program, and be buried for a week with the range of Lyme disease patients really quickly brings you out of where you've been and really opens your eyes on what you can do in your practice. So what was that experience like when you took that time out with Dr. Horowitz?
That was fantastic. It was well worth doing. It's very busy, you know, at any practice in your own shop. So to go take a week, 10 days really with the travel and the arrangements and all that is, it's a big leap for a lot of people, but I'm very intrepid, and I knew that was the next step to take to catch up with the experience other people had. Very high volume practice. We saw patients from Lyme and Old Lyme, Connecticut, bullseye rashes, people from all over the country, the acute clear-cut cases, and then some of the difficult to diagnose cases and the treatment protocols and ways to modify those to help people. And it was just terrific. And it was high volume, lots of work. It was 12 and 14-hour days, and just like a residency training program. It was fantastic. And if you're willing to put the effort in, I think the reward is there for our patients, because that's what it's about. As physicians, we want that confidence to have the skills, and it really, I think, brought everything up to speed for where physicians should go with this. I think that's...
So now that you've been, like, you're back in Ohio, and you picked up and really looked at Lyme and looked at your autistic patients, because there are some people who, you know, they get the autistic label, and when you dig a little deeper, sometimes it's more complicated than that. And so have you been finding that sometimes in some individuals that a deeper look the illness looks different than you first suspect?
Well, yeah, I mean, that's our belief at our offices, that there's a medical basis for the symptoms in autism. And it's not a psychiatric problem or bad parenting. It's just like somebody with a stroke. Their overt behavior and their language is abnormal, but there's a medical reason why that is. And if we find out what that is and look deeper, as you say, we can help them. Lyme is part of it for about 15% of our children and adults with autism, and medical issues with oxidative stress and toxicities of metals and GI problems and neurochemistry and nutrition are all in that mix. And the Lyme has just added another dimension, and the techniques we use in the autism world are techniques for nutrition and brain support and metabolism, and we bring those into the world for our Lyme patients. It's a very nice blend. It's really worked out well for our patients. It allows us to have more tools like a physician should, really.
Well, in my practice, I often bring in nutritional issues, try to eat right, stay away from alcohol if they're, you know, if they're at the age where they can drink. Try to get give them more emotional support, because even if the illness is there, it's amazing how draining it is emotionally on that child, that adolescent. So you must do some counseling, even though it might not be psychiatric, with that family to try to get that child better.
Well, yeah, as a parent myself of a child affected with autism, it's something I come home to every night, and my son and his mother and I And as a doctor, we deal with it in that fashion. And yes, there's a lot of stress, and we always say when somebody leaves the front door of our office, there's not that much support out there, so we try to do as much support as we can. Yes, that's true.
Now, I got a couple questions that came in through the live streaming. Do supplements help autism and Lyme or Lyme?
Very much. I mean, I don't think we could do without a variety of treatments, and any good doctor would use what's available that helps people, and supplements are a big deal because the nutritional components sometimes need to be given at mega doses or they're not available in the diet. And with children with autism and adults, and some of our Lyme patients have very restricted diets, and sometimes they're not going to get all the nutrition just out of food. So we do try to pick some very high quality supplements that are specific for them. We do a lot of testing for things like zinc and GI testing about probiotics, and these are very specific, and just like you'd want just the right dose of just the right blood pressure medicine, even though there are hundreds of them with thousands of different regimens, you need somebody to guide you. And we need to be familiar with this, and sure we do, and it's part of that underlying basis for autism and Lyme that makes our patients get better.
And the second question that came off the live stream is, how could IVIG help Lyme or autism?
Well, it's because it's an immune treatment. When the immune system is sick, the brain is sick, and the fatigue is there, and the patient's peripheral nerves and their feet hurt and burn, and their eyes don't work properly, and they can't think straight. And a lot of our patients with autism and Lyme have a lot of underlying overlap with the immune system issues. We've done a lot of research in that with the curcuminoids and the naltrexone and IVIG, and we use quite a bit of that for our patients, and it helps the immune system get better so the brain can get better, the energy, the metabolism can get the support that the healthy immune system gives the body. So it's a very important part of what we do for many of our patients. Not all of our patients. We select it, particularly OCD, particularly the kids with the very severe immune effects in autism. We do use it as a very important tool.
And some of the kids get better.
Oh, sure, of course. We have many recovered kids with autism who are now in college or in high school in the mainstream without school aids, and they have been removed from the identified category of autism, and you wouldn't know them from a normal kid at all. We have many Lyme patients who have recovered, who are back at work and who are able to drive a car and raise their family and do what they want or attend school again. And then we have lots that are very, very sick and who don't respond to treatment, and this is where the Lyme and the autism, for example, overlap. If we're hitting a wall with somebody who's not going forward, we blend some of these other treatments.
Well, I appreciate the sharing notes with you from Ohio, and because these issues are common to all of us. So thank you very much.
It's great to be here. Thanks, Dr. Cameron.